No.
Yeah.
We're all set.
There you go.
Okay, since it's 4:33, I'm going to call the July 18th, so I got the date right.
All right.
July 18th, 2024 meeting of the Monroe County Board of Health to order. It's like everyone is present. So our first order of business will be to maybe alter the agenda here. We have a couple things that we want to add at the request of the board member and also at the request of the commissioners. So Dr. Robinson, if I'm not mistaken, you would like to have a discussion about the IU Health contract for the public health clinic,
Yes,
which we could have added under new business, I believe.
that would be great.
Yeah.
I make a motion to do that. We don't need to, we don't
Oh, I
need,
can't say.
okay.
Any opposed to changing the agenda to add that item? So we'll add that under new business. Also, under old business, we did not vote on the performance standards for the medical director of the Futures Clinic that we discussed last time in our executive session. So we will need to take that vote there. And there is one final addition under new business. At the commissioner's request, they have requested that Kathy Hewitt to the opioid,
Settlement,
it's a settlement, committee or
like a review board,
review board.
review something.
So they'd like us to establish one, is that what I'm hearing?
No, the county has already established one. It would be appointing someone from the health department to participate in where those funds will be distributed to the organizations in the,
Well, right now, we're just voting to add this light item, so we'll have discussion. when we get there. Yeah, okay.
Thanks.
So are there any objections to these items, adding these items to the agenda?
I move to approve the agenda as amended.
Thank you. Second,
Second.
all those in favor, please say aye.
Aye.
Opposed? Okay, we have an amended agenda. So approval of the previous minutes from June.
I move to approve the minutes from June.
I will second.
Okay, any further discussion? Okay.
No.
Kay goes through it with a fine tooth comb. She knows exactly what's happening. So
There
good.
was one little thing
Have your-
I found, but it was just so minor.
Okay.
Kay would be a good copy editor.
Yeah. Was it a punctuation or? grammatical.
It was just a misidentification.
Well, maybe we should address it then.
Well, it was so minor. It was when we were talking about, adding the maternal child position.
Mhm.
And, I, under my breath said, and Lori, where are you gonna put her? Remember that?
Yes,
And then it said that it was Aurora that brought that up.
okay.
Where are you gonna put her?
Oh, I think we both must have said that at once, because I do remember myself bringing it up.
Well, then you take.
I have a feeling,
Well,
we
you
both
both get partial credit.
great minds, great minds.
Take credit. I'm fine with that. That was the only thing I noticed when I read it.
Okay, so we would amend the motion to accept that. Would you accept the little addition of the amendment to your motion?
And Kate,
Yeah, yes,
sure.
okay.
Okay, and Kate.
And it's been seconded. So all those in favor of approving the minutes with the addition?
Aye.
Aye.
Opposed? Now it's time for public comment. Do we have anyone from the public at this time? See anyone? No? Commissioner?
Yeah, I'm wondering if you want to have this discussion now or
We
later,
can't
but,
hear you.
oh. Well, my mic is open.
No, it's fine. Let's see here. I need a mirror so I can.
That's no doubt.
She's muted.
Yeah, I just muted to see if I could communicate.
Let me try that again. Can you hear me now?
Okay, we're working on it. She's not muted.
What about at the bottom, Linnea? If you look at the.
Oh, it's muted at the bottom. Yeah.
Aha, there it is.
Thank you.
We discovered our problem. I think.
Speak to us, Julie.
Try it again. Testing,
No,
testing.
no,
Can't
no.
hear you.
So it's gotta be in her.
It's unheard.
I'm definitely not muted. No.
Who reads this?
Maybe she could hold up some cards. She has to say.
Do you have any flashcards there? Yeah.
I don't know what else to.
I don't know if you can hear me now. Nope.
That would be our mic.
That would be, yeah, that's from the.
All
Can you
right.
hear me? Can you hear me now?
Can you hear us?
I can hear you.
Yes, no?
Well, now she's frozen.
Yes,
Yes, okay.
You can hear us, yes.
We can't.
Yeah.
Thank you.
All right.
Okay, yeah, someone needs to contact IT and find out why it is that we can't hear her.
Sorry.
What is that?
I do that all the time.
No, that's because they just muted her.
Oh.
Allow mics. So, try again, Julie?
Testing again.
Look it up.
Testing, testing. No.
Maybe she's not been brought in. I'll ask IT to fix it.
And the next person on the agenda is Lori. Oh.
Okay. She can discuss that.
Well, with your permission, why don't we skip to the first, we
can discuss that between the administration.
the second item under old business, which is the voting on the performance standards
Yeah, that should be.
for
a
the medical
slam
director
dunk.
of the futures, which is should be a slam dunk. since
Yeah,
we
because
discussed
we
that last
talked
time.
about this last time.
You've seen those, right?
It's all,
You saw
yeah,
those.
we presented them, we discussed them.
Mhm.
So,
All right, so I would accept a motion to,
Approval of the performance standards for the future.
second,
it had been moved and seconded to accept the performance standards for the medical director of the Futures Clinic. All those in favor, please say aye. All opposed? That one is taken care of.
are we able to do Lisa's thing or not?
Yeah, that's what I'm looking at now, is that maybe this, but they just skip around like this, but
I probably need Lori, a couple of things from Lori.
Okay, that won't work then. Can we talk about the addition to the number of the
Of the-
addition to the member of that board that you didn't want me to ask about because we're just voting on whether to add it to the agenda. The last item we talked about adding to the agenda.
The opioid.
Kathy.
Oh, the opioid.
Yeah, can we
Commission.
talk about that?
We could,
Okay.
if Lori were here, because I just found out about this,
Okay,
like,
We all just found out about it
Okay,
before we
so
got
then-
in our cars to come down here.
Well, why doesn't everybody tell me about the visit yesterday since I finally got delivery at 5 o'clock? And,
They made you wait all day?
well,
Yeah,
not
so-
only from 2:15 till 4:15, then they should have,
That's nasty.
yeah, I thought for sure.
well, the visit we had on Tuesday, 2 days ago, actually, at the public health clinic was, I thought, an excellent visit. We went through
It was stupendous.
all the departments, I found all the people that were head of each department very articulate and there was no hemming and hawing. I mean, they know their business. It was apparent. And, all the accolades that these different programs are getting, some of them even nationally, was very impressive. And, you know, everybody jump in here who was there, but I mean, that's, you know, sort of an overview. I mean, it really, I'm not saying it was too bad you missed it because it really was too bad you missed it.
It's amazing the work that they're doing and they had actual outcomes, like client outcomes, that, you know, like we placed highest in this and this and this, and it was impressive.
I'm so sorry I had to miss it.
We're sorry we missed you and
Glad
Dr.
everybody
Brittany
else got
at the
through.
open house.
And it was so sensational.
And we had some lovely refreshments afterwards and I took a nice brownie home to my wife for brownie points.
Oh,
There you go.
So are they
Only
coming?
knows.
Yeah.
Or are they-
He's gonna see if he can get someone to cover the phone so he can come over.
Good. Okay.
They can't remote in?
So it seems not.
Oh, okay. Okay.
All right.
doesn't have far to go.
So Lori, we've already, we went ahead and voted on our second item under old business and why don't you do your admin report?
Oh, sure. Okay, so, the public health clinic, I received a little update from Lindsay today. Monkeypox or Mpox vaccines will be available again this fall, if or as needed. We are currently without COVID and flu vaccines. We're waiting for the new formula for fall. They're planning a back-to-school vaccine event on Saturday, August 10th from 8 to 11 a.m. For our environmental division, so foods, the fair inspections were completed during the county shutdown. So we were pretty excited about being able to complete those. Summer feeding program inspections have been completed. Planning on the second round of farmers market inspections currently. With wastewater, the part-time employee is helping with real estate inspections, which is helping to take a good amount of the workload off of Cheyenne and Matthew. General environmental, West Nile has been reported in mosquitoes in Indiana, but no human cases have been reported. They are currently trapping at parks and private residents to send to the state lab for testing. We are still using that stat courier system to send for one of the state interns that's doing mosquito testing as well. Population health and outreach. So we had a Facebook post about food safety during the power outage, had the largest reach of any post in the last 18 months. Tick-related posts have been especially popular, and we are currently reviewing applications for the harm reduction specialist and will begin interviews for that position soon. Public health emergency preparedness. So Christina did accept the behavioral health and wellness coordinator position. We have kept her in the preparedness position though, due to the storms and trying to kind of get some succession binders and planning figured out. So that's been really helpful, but we do plan to transition her into that new position, July 29th.
And that's Christina King.
Yeah. So we're originally hoping to get her moved over sooner, but with the need to keep her in preparedness, we've done that. Still distributing hygiene kits to, community agencies. We purchased, a large amount of supplies also for the schools for hygiene products. Lisa recently came and picked all those up and will begin distributing them. We are distributing cooling cloths, with postcards included with just some general recommendations on heat safety. And let's see. It's really kind of the gist of the past month. Thank you.
Questions for Laura? Comments?
It's kind of peripheral, but I'm better resurrect the medical reserve board. And
Since it wasn't on our agenda, I have that at the very bottom to talk about.
That's in our-
Yeah, find out, you know, why,
The legal stuff.
yeah, the legal.
yeah, we're gonna have a powwow tomorrow afternoon.
All right.
We can come up with
Well,
just,
then maybe you can fill us in after you.
I'll send you a message.
Okay.
For whoever wants to be in.
And were we able to control the salmonella outbreak? Wasn't it?
So I was talking with Sally about that today. That guy is a carrier. He's still testing positive. And the deal is he's got to be 30 days without or 2 back-to-back negative tests, and he hasn't. It's been a couple months and he still isn't testing negative. And so he's not able to go back to work. Something like that, yeah. So they're on it. They're they're paying attention and doing all the right stuff, but it's an odd set of circumstances. And
Sure.
Yeah,
It's Julie Thomas, we couldn't hear.
yeah, we should try Julie.
You gotta say, have Commissioner Thomas, see if she can, communicate with us now.
Can you hear her?
She has some.
Can you hear me now?
hey,
Yeah.
All right, let me know when is a good time. I've just got a couple things I want to talk about.
Just
Doesn't,
better-
not urgent.
Our administrative, discussion, so actually, now it'd be
Okay.
fine.
Okay, great. So,
Yeah, but hang on. I think he wants to tell us something.
But
So
he's
So this
still-
doesn't happen again.
Speakers were set to Samsung, which is the TV. I switched it to the OWL, which is that right in the middle.
Okay.
So I don't know if she was coming really quiet or if it wasn't coming.
Oh,
through at all.
yeah, she was whispering basically.
Okay, so yeah, that's what it was.
Thank you.
Yeah, Thank you.
All right, thanks a lot.
Awesome.
I never whisper. So, so it's a good time to thank all of you for your service on this important board. One of the things that we have heard about and we are aware of just from our office and from our Board of Commissioners is that we are aware that there are some space needs issues that are present or coming very soon to a theater near you. And so I wanted to talk about a couple of things. One of them is that we are actually looking at, and this is not a done deal, so don't take it that way, but we're actually looking at a way to move our employee health clinic to the North Showers building, the Monroe County Government Center at North Showers, which would free up some additional space for your department. But one of the other potential opportunities, and this is something we're going to ask you all to look into if you wish to, and you don't have to if you don't want to, is to determine whether or not we want to try to move the Futures Clinic potentially to East Miller Drive, the public health building, or if you don't want to do that at all, that's understandable as well. So we have no intentions of eliminating that service. It is so vital for our community. But that may be another additional way to free up space for this health department. I also want to just offer some information that 2 of the ambulances of the 4 that were funded by the American Rescue Plan Act dollars have now come online with the Monroe County Fire Protection District. So they provide basic life support, not advanced life support, basic life support. They are connected with the dispatch, Monroe County Dispatch already. So I think they got a call the first half hour they were online. So much needed, happy to do it. And 2 more are coming down the pike. We had a ribbon cutting yesterday. But anyway, I wanted to share those things. We also, I'm part of the steering committee for the Monroe County Health Equity Council. And our goal is to bring health issues to the government and government to the people to help address health issues. And that, public health is a huge topic and a big umbrella that covers a lot of things. Well, one of the things that they have ongoing, Kathy Hewitt's been an ongoing member and she's been a great asset to us. But one of the things that we do have is a website, and that website really needs to be hosted. Right now it's hosted by an outside organization, and I think that's fine, but we do have to pay a bill, and it's about $250 a year. So I wanted to see if there is a way to find some health department monies to actually pay for that website now and in the future. It's a conversation that will become salient in August before the council does its magic with the budget for 2025. So I wanted to bring it to everyone's attention to see if there is an interest in doing it. If anybody wants more information about the Health Equity Council, please contact me. I'm happy to talk about it nonstop. So I will stop. Thank you so much, everyone. And I'm here if you have questions.
Well, I'm glad we were able to get you vocalizing. And yeah, it worked out.
So, the Futures Clinic originally was a chat clinic on Miller Drive.
Yes, we discussed that with Amy.
Yeah.
She said
And when we were there,
originally,
they didn't
it
look
originally
like
was.
they had any space at all. They looked like packed like
They are
sardines.
tight
So, and
already.
plus, that space down there was specifically rehabbed for the Title X clinic. So all that money that we spent for the exam rooms and plumbing, and it was a lot in the waiting room. If we were to move that out, we'd have to undertake construction again to turn it into.
Yeah.
But I mean, it's certainly worth thinking
I
about.
think that's some
It
offices
certainly works.
with sinks in them.
Offices with sinks and, exam tables.
Yep.
And speculum. And, who doesn't
We
want
don't
their,
need to go
who
into
doesn't
details.
want their office to look?
Yeah, it's certainly a lot to think about. So, and a lot to discuss concerning the Futures Clinic.
How awkward would it be for employees to go to the showers building for appointments compared to being here?
Probably.
Pardon?
60112.
How big is the space?
Yeah, if I might, that's one of the things we've talked about, and there's actually more parking available for employees there at that building. So,
Good point.
in terms of that, it is better. However, it's going to be farther for some employees to go and shorter for others. So it is a toss up on that.
Is there space available there?
Yes. Yes.
Oh, well, that's.
Yeah.
That'd be a blessing to open up that space.
What space is that?
Everside,
Oh, yeah, that would be amazing.
that would
that
really
would
fit the
be-
bill for what you need, right?
We're very excited about that.
Yeah, that would be some kind of wonderful.
That'd be great.
Great idea.
Yeah, I like that,
Thank you.
Julie.
I did, if you want me to touch on it. I did meet with our maintenance department about trying to restructure some of the downstairs space that we currently have to add additional desks. And we found we could add at least one, if not two, and still be in compliance with the fire codes. We just have some other shelving that we need to move out. But he did say that we could do that, to help get us another in the
And it's
interim.
accessible because it's a ramp.
Right. Right.
There's a lot of stuff stored down there too that doesn't seem to be serving a purpose.
Yeah, we just need to do something with it, really. There's a lot of just
Garage sale.
random stuff.
Like garage.
Well, I think they take it to an auction, he said. Mhm.
You need to get rid of it. The other thing that you raised, that, I think it's just a question in my mind, and I can save it for new business if you want. It's just, she raised the question of the Health Equity Council website.
Mhm.
And my guess is that would fit under our Health First mandates, that equity and social justice are a big piece of what we're trying to do through Health First. And so, I think that our being not only part of the council, but hosting that website would help to actually further our goals in Health First meeting.
Should we discuss that now or stick it on new business?
Is that, is
what-
it a website for patients to access? What is that website for? What does it do?
So what the Health Equity Council does is it highlights the voices of those who feel powerless and tend to be powerless in community decision makers, decision-making process. So it is a way to bring people together to ensure that those who feel voiceless are actually given a voice. And it is more geared for public health. It is not a patient portal by any stretch of the imagination. And one of the things we're working on is bringing government to the lives of people and people into government and their voices into government. But it revolves around public health. We started off as Community Voices for Health, CVH, and we morphed into, and we had a Robert Wood Foundation grant that we worked off of for several years. And now we are the Monroe County Health Equity Council. Anybody can become a member. One of the things we're looking at doing in October is bringing healthcare providers to a large in-person meeting, and then facilitating conversations like we did with Community Voices for Health, that we've done with the health needs assessment process as well. That would include Monroe Hospital, HealthNet, and IU Bloomington Health. Bringing those folks to a room, having them share what they're doing, the struggles they're facing, challenges they have, and then actually sitting down and having conversations with residents about their needs and their concerns. So it's really a public gathering space. And it's not a patient portal by any stretch of the imagination.
So I would want to know that, I assume you're wanting some money from the Health First funds to fund that. Is that the idea?
50 a year.
It's $250 a year. I just am trying to find a way to fund it through the health department. And if wanted to see if you all were interested in doing that in an ongoing basis.
So are there KPIs associated with the health equity requirements for the grants? Is that the health equity portion, are there KPIs that we have to follow?
I could probably look at that and talk to the new regional analyst. They've changed the way that they did the budget submission, so you're only allowed to select the pre-selected options that they give you, and you have to individualize every single item directly to a core service, how it's meeting, does it meet the 60% or the 40%, the person, so you really have to kind of line it up. Honestly, it would be easier, I think that this would fit with our health department, but it would be a lot easier to just put it in our county funds.
Yeah, it's $250 and
Yeah.
it's consistent with our mission.
It would be so
We
much,
could pass the
yeah.
hat.
yeah,
Yeah.
Considering we have, the budget we have. I
yeah,
can't even
Yeah,
believe we're
yeah.
talking, we've already talked too long
Believe it.
about this $250.
yeah.
Yeah.
Or, yeah, throw it
Thank
in
you.
that.
All right, any further discussion about, well, I think we could go ahead and,
I think we can just vote, can't we?
But you need a motion.
I moved to $250 into supporting the Health Equity Council website
I second.
from Monroe County,
any,
From departmental funds.
from departmental funds.
For many.
any more discussion? All those in favor, please say aye.
I,
Opposed? All right, motion passes. We sort of discussed this a little bit, but I guess we're finished talking about that, right?
I think we're done.
We've touched on a lot of things.
This is a very interesting meeting.
It is.
You know.
Yeah,
you're
we're all
really
over the
holding my
place.
attention.
Yes.
Thank you.
Hard to fall asleep.
So
Yeah,
we're in discussion.
discussion of department space.
If there's anything else.
And we-
Isn't that what we just did?
Yeah, exactly. Yes, that's why I said we've been all over the
Except we
place.
took a circuitous route to
Uh,
get there. So
okay.
is
Yeah,
there
you-
anything else you want?
Yes, is there anything else you want to tell us about department
It's
space?
just that it gets really hot in this room.
Yeah, well,
So is there a timeline on this move? Do we know anything about that?
At the clinic,
Yeah, to go to showers.
I think she said.
Is it
they were
gonna
just
coincide
thinking
with
about
the
it.
new management or?
She said they were just thinking about it, so we shouldn't get excited, but
So it's
Let's get
a pie in the sky.
I think we should say we support it.
I would wholeheartily recommend that the department or the board make some kind of a declaration about
She's
that.
back.
Don't you think? Wouldn't that be?
There's no need to do that. Appreciate it. I took your notes. I have your comments. We have a number of things we have to do before we make that final decision, but we're thinking about redoing that space anyway with the new contractor coming in. So we thought this might be a good time, and we know you all are hurting for space. So I just wanted to let you know that it's on the table and we're looking at it.
We are tickled pink.
So
We're so happy to have someone here who has authority.
Yes, yes, thank you.
Yes, thank you.
Lori,
Yeah.
first of all, you obviously need a cooling towel.
Where's Christina?
And number two
Yeah.
is, so have we ever figured out whether there's any portion of the whole health department that does not have to interface with the public on a regular basis, that could be up in the attic, and whether we can actually utilize that space
I
in any way?
think the last
there's a
time we
problem with
talked
the
about
attic.
that, we can't do that because it's not
You have to have an
acceptable.
elevator
It's
for
not,
public access.
no, even
Even
for
for employees?
employees. Yes, what if we have an employee that has
It's not
has a mobility
not an
impairment?
Well, then couldn't we put them on this floor?
You have to, per code, you have to have accessibility. If you're gonna have a second floor, you have to have an elevator
A third floor.
or sorry, third floor. You
We
have
put
to have
in
an
an
elevator.
escalator instead. I like this.
Oh, what?
Escalator.
I like the idea.
You could do an external one.
Yeah, let's
You
put
get on
it,
the outside.
you know, kind of like those great.
What about just a
hotels,
little
and it'll
rope
be
and pulley
glass,
kind of
and
thing? Dumb waiter?
We could
We'll-
simply
we'll
have a
have a big
forklift
set.
on the outside.
See?
and
We got all
have
kinds of
the work
innovative
or forklift
Okay,
on the window.
All right, so we don't
Not
really,
practical.
we don't need to discuss department space any more than we have, in your opinion.
I don't, no, I don't think so.
Okay,
That would
Good.
certainly be a fix.
then that would
It's nice that
include
it's getting
old business.
discussed though,
Yeah.
because it's clearly a need.
I think we have to probably discuss it every time we meet,
Yeah.
because until we resolve it,
Not let it drop.
yeah.
Mm-hmm, sure.
All right, we're moving on to new business, PAC.
Okay.
May I ask a question before you start doing this?
Yeah.
I am wondering what this document with changes, what's this, I know, it's hard to get it out of my mouth, so this makes sense to me, this is a new position, right? And this is an existing position
Mhm.
that you're amending.
Mhm.
So this needs to go back through PAC, and then it looks like you have some salary, some increases here, which
Mhm.
makes sense.
Mhm.
But what is our role
Mhm.
on this document? Because I have a concern about the edits to this document, and I want to make them at the right time.
Sure. So, this would be to approve these edits, or you could make, or we could make changes before it goes to the PAC meeting to determine whether they would send it on the list.
Okay. So then I'll put it in my lap and you let me know when it's.
I think we could do that now.
Yeah,
So there's that one, so there's two. So if you have things you might want to change in that, you might have things you want to change in that.
Yes, I guess both of them. I only saw it on the one. It's the same item in both of them. Are you ready for me?
I'm ready.
Okay, so I've picked out the two DIS positions. And I have a great deal of urgent concern about the edit. And of the second edit conducts community education for local schools, workplaces, health fairs. Is there something behind this? Like, were we told to add this? How did this come to be? Because this appears like a very good thing. In reality, it's a horrible, horrible thing. And so I want to know what the rationale was.
So currently they do participate in some community outreach and events, for example, sex, drugs and rock and roll, some of those community campus events, some, Terre Haute, like the Pride festivals. So trying to find, language that captures some of that community engagement that they're doing to put it in the job description.
Gotcha. Okay. Then I think I could probably be satisfied if you take out local schools. And here's why.
Oh. Mhm.
So in reality, the reason why this is a terrible idea, especially in Indiana, that provides little to no sexuality related education in public school systems
Right.
statewide. I used to help the Department of Education go around the state and train teachers and school nurses so that they could discuss these things and they could deliver whatever curriculum their school district was using. So I know this. So they have very little to no way to get any health education in there related to sex, reproduction, STDs, anything. And so that's the baseline. And our DIS are very, very highly skilled and trained for disease intervention. They have a purpose. They're not community health educators. They don't have CHES credentials, for example. While they do provide some education one-on-one, usually to clients in the course of their disease intervention work. If we found out the hard way up in Gary, actually, that a couple of our DIS were being called on constantly by the schools, like they had to come to us and say, oh my God, the schools want me every day, everywhere, in every school, at every level. I can't do this at my job too. And even though MCCSC is awesome in terms of what they'll provide compared to the rest of the state, I would not want the DIS to find themselves in a position where they had any school response. That's the school's responsibility.
And it may be our school health coordinator position.
And we have, yeah, so
DIS.
DIS, it's the same concept as working at the top of your license. Like this is not what they should be doing. So if you don't mind taking out local schools, I thing.
I mean, we could take it all out.
Well, I mean, I like that you, because they do some of
Some,
this
yeah.
when it's very targeted to or population at the highest risk of sexually transmitted infections. I mean, they're really good about
Mhm,
saying, you know, yeah, I'm gonna do this, but no, I'm not gonna go talk to
mhm,
a bunch of people at no risk.
mhm.
So as long as, I mean, as long as they keep making their decisions the way they've been, and if we take out local schools entirely.
Or I'm curious, are any of, usually are any of the DIS specialists actually trained in how to teach, how to speak to children?
No,
Who have been exposed and may be carrying or transmitting sexually
well, no,
transmitted
that's not their job. That's not their, no, because we don't serve, we don't serve children.
So
We serve,
who within the health department actually, if you have a child with a sexually transmitted disease, who is interacting with that child?
Child Protective Service.
Child Protective
Well,
Services.
That's as far as it gets.
Yeah, we
PCS
can't.
is useless in that
It's,
regard,
it's
so,
useless.
Yeah,
yes.
but this is, you're asking, once again, a very good national question. Won't be solved in Monroe County, I can tell you. Won't be solved, it's a national question. Thank God, there are few children with sexually transmitted diseases. But they all go through the child protective system because it's a crime. It's
Yeah,
not,
I know it's
They're treating
not.
it legally, not medically.
That's what I was going for, yes, thank you. And we're not equipped to do that, that's not our job, so.
Okay, that was my question about that, because I know there are children that have.
I didn't say there were none, I said there were very
There are
few.
there are few, and I understand why we might want to.
And they also, in Indianapolis, they have a special team of clinicians that deal with that, I know.
And we know that there are local schools that would never permit anyone to talk about sexually transmitted diseases, much less how one might acquire one of those. So,
It was because they go to the university, but I'm fine. I mean, it's fine. We'll just take it out. I'm just trying to use a general
Yeah.
term.
Thank you.
To cover
No, it's-
anything.
I think it will.
It's a bigger discussion than we can tackle.
That's right, actually,
I just think it will.
if you don't mind removing local schools, I think we're good.
So could it
Absolutely.
be changed to public schools or?
No.
No,
No
no, no schools,
Just gonna
no.
leave
No
schools out,
schools,
but-
okay,
No.
okay.
we could always call that a community organization if we needed to go to a school, so.
And also, India does have so many resources.
So, right.
They don't.
So,
They don't.
so would we actually, I'm curious from what you're saying, or do we need to actually say that it conducts community education for adults in all these places? Do we need to be that specific? Okay, just asking,
I mean, they
because you know, if
know.
you got a kid in healthcare that wants sex ed or wants to learn about sexually transmitted diseases,
They're just not gonna touch that with a 10-foot pole.
okay. Good enough.
But we need a motion to send for this
But we just
wording.
need that, yeah.
Well, so the last time our attorney was here when we did these, we did a big batch of them. So,
I just do these.
Big batch.
yeah, that would suggest we go through them all and then. you
Sounds
can
good.
just- Okay. Let's see. There really shouldn't be much of anything on the others. So for our environmental division, just adding the language in there for cross-training, that is currently occurring, and have added, let's see,
Preferred on some. of those.
preferred with the job, requirements with the bachelor level degree, and then adding the requirement of associate degree with 1 year of related experience. And there was a public health preparedness.
Yeah, it's.
Yes.
It's a-
So those those are just the only changes with that, and adding variable, with the work schedule. Just because they do, so.
That makes sense.
So if there's no issues with that, then I think we could just move on to the new position.
And we don't need to do anything with these,
No.
with the rate adjustment, okay.
That's my new position.
So I wanna say thank you to
Yes.
Kay and Lisa. In addition to Lori for helping
Thank
draft
you, Lori. Yes.
this maternal and child health coordinator.
But, so this,
Oh,
sure. So this first would be going to PAC to create this new position. So it'd be a little bit different from some of these other jobs, descriptions, just approving the minor changes in the classifications. This position will go through the whole, procedure of, they will review the duties, determine what, or recommend what it should be classified, and paid at. So, and this would be put into a cleaner form like this, of course. So
So when will this actually go to?
I hope August sixth. That's the plan if you
Okay, that
vote on
sounds good.
these tonight. Yes. So some of the big key ones with our Health First requirements, so subject matter expert with our FEMUR group, so fetal infant mortality review teams, developing our evidence-based programming to reduce our mortality rates, and implementing a documented process for referrals. Questions, concerns?
This is just for one person?
Right now. Well, I guess we could ask for two.
it was a lot of work when I looked at it. Um, And I also wonder, given what we learned at the public health clinic, if we want to, or you want to change some of this, because, for example, provides breastfeeding support services, blah, 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 ensure postnatal resources, they do that already. So it seems like we want to make sure this doesn't duplicate what's already being done, but this coordinates with that.
Which this position can definitely collaborate with that. I think this is more about, this is expanding, so we have our person here expanding, reaching some of those other clients that might not be getting serviced, and then collaborating with the,
Okay.
with the
Okay.
clinic.
Okay, as long as you don't feel it's duplicative. Okay, good.
And like. Is there anything that we need to say about that kind of coordination and cooperation between those two entities? Is that something we need to include?
That's something I would actually include in our public health clinic contract.
Okay,
Yeah,
yeah, I just,
that they have to collaborate and partner on and use our programming, collaborating with us on all of that.
And there is one there, connects the population to needed health and social services, communicates with director of clinical care. I think we're probably good with this. So good job, Lori.
thank you all.
I'm excited.
Yeah.
I
want them now.
I want them now too. I think all three of us were very excited as we
It's
were
gonna be a
doing
year and a
this.
half later.
So I'm curious, do we actually ask for two individuals rather than asking for one, or do we just keep going back and begging?
We certainly could at least ask for that and see kind of where we go from there.
Do we have actual numbers of clients that we would expect for this coordinator to be interacting with on a daily, weekly, monthly basis.
I think the
So that-
problem is we need this position to do
First,
the community
obviously.
needs assessment to count the people.
But we
Which is-
have to
which is
serve-
a
We have to
weird
start
position to
somewhere.
be
Because
in.
then that puts us
right?
in a really awkward position to
Kind
go
of
and say,
retrofitting.
we
But-
need two people.
But hopefully nobody
Okay, you have
asks
some
that
thoughts
question.
on this?
My thoughts are, we ask for one position, we see what the workload's gonna be like, what the assessment shows us.
Mhm,
We may indeed wanna ask for another.
Absolutely.
Or half of
I
a
would
person.
agree.
I'm not asking for half
That's,
people.
could be, who knows?
Or a lower level person to take
Assist.
some of the
Yeah, to do some of the
responsibilities.
data stuff.
Yeah,
Okay, so
yeah,
we
yeah,
need a
yeah.
Motion to approve.
So how should the
This-
motion be
You want this-
worded?
Yeah, this is,
Given that we have an amendment to two of them.
It seems like this coordinator position is new to us, and so it seems like that would be a separate motion that we simply ask for PAC to assess this position and get back to us. But that I would move that we, as a board, agree to this beautiful new position of maternal and child health coordinator and send it on to PAC for their assessment.
Second.
you guys did it. So if you're making the motion and seconded, further discussion. All those in favor, please say aye.
Right.
Aye.
So
Now I'd like,
Opposed?
now can I make a motion about the rest of the
Yeah,
PAC? All right, so I also.
if you're moving, you're
I'm
really
moving
moving
on
tonight.
here.
Yeah.
So I move that we, as a board, approve and agree to these assessments that we have in hand for all of these other positions.
With the
With the-
change to
With
the DIS.
Yeah,
Yes,
with the
yes.
change.
that eliminates schools
Local.
from local, any dance from our
Actual word.
BIS position.
Okay, it's been moved. Second, did somebody second?
I'll second
Okay.
Thank you, George.
All those in favor, please say aye.
I,
it. All right.
Opposed? All right.
Yeah,
So will that be funded through Health First?
Yes.
And how many more such positions could we fund, or could we support through those funds?
Through Health First?
Mhm.
Well, I think that's challenging to say without knowing what the local dollars will be putting in. So I
So
mean,
some of that has to come from the county, right?
yes. So if I were just to guess, I guess, or estimate, position wise, I'd say 4 or 5. If the county does not approve the rate that I currently have, which is a little bit higher than the minimum that they're required to pay in, we could probably do 2. Potentially,
In addition to this or with this?
in addition to.
Okay.
Okay, next item is step increases. Salary.
Yes, so, currently our county salary grid, so there's step increases for certain length of employment for all employees. Currently, that is capped at 25 years. So I did speak with Miss Kim Shell, and our county council liaison. We have a 32-year employee who essentially has not received any of the county raises from that 25-year point, about options that we could potentially request for council to be able to provide this employee with some type of compensation since they are essentially off of the salary grid. It would not be a PAC recommendation because it would just be a financial decision. So the request is that we ask the county council for some type of a salary increase for this 32-year-old 32-year tenure employee.
I really find it interesting that they top out at 25. What's their,
That means
they don't
you
have an
leave.
expectation that someone
Yeah,
will
you
last?
quit. You quit after 25.
Do- do
7
we-
years with no salary.
Yeah, that's-
increase.
Yeah, that's not fair.
That needs to, we need to.
Are there others that are over 25 years?
Not here currently, at least to my
But in the county,
calculations.
you would think there would have to be,
Oh,
right?
The county, yeah.
And
Weird.
if you start at 20, you're only 45.
Thomas knows if there's any other employees that have been around more than 25 years and who haven't had salary increases.
Well, it's not that there aren't salary increases, because every year the council will increase salary based on growth quotient, inflation, and other things, and everybody receives that salary increase. So it's not that a salary is static. It is just that they decided to do what are called step increases to try to entice the longevity of employees at certain benchmarks of their career. So it's not that somebody who's here 25 years gets nothing. It's similar to somebody who's been here for 12 years who doesn't get a step increase, but everybody receives the salary increase.
They're waiting for their gold watch. Okay.
Well, so, but I'm not sure I really understand exactly. They get the COLA, like you're talking about COLA, yeah. But there's really no other additional compensation on top of that. Is that correct?
There are what they call step increases at particular years. I think it's year 10, 5, 10. Lori, do you remember that number? I don't. It's certain, and then at 25, there's another one. So we do have employees that have been here longer than 25 years.
Not beyond 25 though, since that's what we're talking about.
Step- not the step-
No,
Step-
but
step-
yeah, the step increases, but the step increases aren't every year either. They're just sporadic.
But of course, we're talking about 7 years past 25, if not 25 years, somewhere in there you would think, well, anyway, that's
So
a,
what do we need to do on this? Is the motion to ask the
Request
county?
council.
I move
Yeah.
that we discuss with the county council if there's any way to additionally compensate a health department employee been here longer than 25 years.
I second that.
any discussion, questions? No? All those in favor, please say aye.
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 Opposed? Motion passes. I think it's a great idea. See if we can get anywhere.
All you can do is ask.
Did you have anything else on step increases?
I did not.
All right. The next agenda item is the commissioner's request for a member of the health department to be appointed to the opioid review board. And I believe they specifically mentioned 2 possibilities.
But if they requested someone from the Board of Health, that's one of us, right?
No,
Not
it's the
health
health
department employees.
not us.
Employees, yeah. And actually, they have, Kathy has been actively involved in
Harm reduction.
harm reduction, so, yeah, so.
So is
And she
it,
seems like the likely candidate.
She would be the most knowledgeable, I would think. My only question is, in terms of workload, what will this new responsibility mean, and will it pull so much of her time that she will have a hard time getting her other stuff done?
Do we have any idea how often they meet or anything else about?
Is she currently spending any time on this as it is?
Yes, she has been, in a different capacity. I think it's really about trying to find the balance between the time that employees are spending on committees and councils and meetings with, work that's contributing to the core services, in the community. So it's hard to say, I guess. I can't remember at this point in time how often this particular group will meet. Yeah.
Does
could
Kathy
ask
know?
her.
Kathy, do you know?
And
Julie
Julie
knows.
seems to know.
I know, I
Oh.
believe it's quarterly, and it's to review applications to spend opioid settlement dollars.
Okay.
So is there an Indiana code, is there a code or written code that says requirements for who this person should be? Because I know there's a very long list of codes administering these funds.
We can we can have sent to you this is a local commission that we set up as the Board of Commissioners, the legislative and executive branch of county government. And we have outlined in that who should be on this committee, and their knowledge, background, information, et cetera, in terms of what they can contribute to this committee that meets quarterly. So we can send you a copy of our local ordinance that established this commission, this board.
So my concern is, you know, are there other people who might want to do that? And I think it's super important that we, you know, make sure we're being transparent and seeing, you know, where these funds are going. So I think, you know, if everyone thinks that Kathy Hewitt is a good person to do that, for instance, I don't think that what should happen is we have a large sum of money coming for the opioid settlement funds, and I don't think that should just get directly funneled somehow to IU Health. I think that's not necessarily the right thing to do. So if Kathy, you know, is someone who can represent or think about things in that fashion, then I think we should consider it. You know, that's a position that, you know, even I might be interested in doing that. So I guess I think that, you know, I would definitely like a list of, you know, the requirements for this person, who this person is, and maybe a little more time to kind of vet the process.
That money coming directly to us.
This is the description.
Oh, yes, yes, I
Did you
have
see that?
this. Yes, this is for the
The
requirements for
process.
the program
Yeah.
that gets approved.
But there is a list of desiderata for the.
That's for the
participating.
county, that's our that's what the county, from my understanding, that is what our county created for the proposal review process.
For a proposal,
Proposal.
but
that are
not for who's on the
submitted.
board, not requirements for who's on the board.
Correct, yeah. I couldn't really find anything else. I did find that, but I'm happy to ask for, any additional information.
So do we want to defer this, decision?
Well, it sounds as if we agree that somebody from the health department clearly should be a part of that process. So that part is a given. Who that person should be is the question I hear Dr. Robinson
Well,
ask.
but there's a big difference between having a health department employee
Yeah.
and a health board member.
Member.
Yeah, so.
But someone from the.
So
Nobody from the board was asked. So, I mean, I don't think we can just insert ourselves. They asked for a health department employee. They specified the health department employee they felt had the greatest level of knowledge and expertise. I'm not sure why we're quibbling. I would just let Kathy do it, and maybe on the board, there is a public position that you could serve on if you have that interest. I don't know what their board makeup is.
So is Kathy, is this gonna add excessively to her duties? Or,
I don't think I could answer that. I mean,
Well, since this is a one-time distribution, I don't think anybody really knows the answer to that, although it's obviously the meeting itself isn't gonna take that much time, because it's quarterly. So once every three months, but
Reviewing, we don't
Yes.
know how many things they have to
Yes.
review.
exactly. We don't know how much work goes in outside of that, of the meeting itself. She is doing some of this, some things with this now. So I don't know any way that, Kathy, you're there, so do you have anything to, add to this discussion?
The current work that we've been doing is putting this whole process in place. So that's the work that we have been doing, but now it's transitioning to actually accepting the grants and reviewing them. So it'll replace what we currently be doing now, and it would be just be the new process.
So do you see it, in your estimation, do you see this, adding a lot of additional time?
Basically.
I'm sorry, I didn't hear that
Yeah, we
second
had two
part.
people talking at once. I'm sorry.
Sorry.
Do you see this position as adding a lot of, the new position, adding a lot of extra time
It would
to
take,
your job at this point that would be taking you away from other duties?
I don't think so. Or it would be reviewing grants and then having the meeting to review them. I don't think it would take a great deal of additional, it would not take additional time to the meetings that we were doing prior to the process of setting it all up. I think it would even out or be less time. That's at least my estimate right now.
Yeah, I understand that none of us really know, including yourself, exactly how much time it was gonna take, because we haven't done this before, so. I
I
would entertain a motion
I would move,
or, there we
I
go,
would move
you can move.
again. So I would move that we have a health department employee on the Monroe County opioid review board.
Is that the motion?
Yes, that's my motion.
Okay, so is there a second to that?
So that leaves open who that might be.
Well, and that,
We're just gonna
You
leave
know-
it that way.
Maybe they need
don't
to
think we
fill
need
in.
to.
Commissioner Givens, in my understanding, had requested Kathy.
well,
Is that
and
correct?
that can happen, but I don't know that that has to be part of our motion. Our motion could be less specific, because this will be an ongoing review board. When and if Kathy ever retires, she would still have to sit on that board if she's the one that we have voted to put on the
She
board.
wouldn't be a health department.
That's a good point. She wouldn't be a health department employee.
Well, that's why I'm saying, if we make it a health board employee, then, it would go to someone that we assume our health administrator would know who is being asked for and would make the appropriate assignments.
Let me ask a legal kind of question though. Since this is going to be a formal appointment, don't we have to specify the name of the person before the county council can appoint them?
Is there some way we can qualify this, say,
Let's ask a policy expert. Oh, she's gone. So we can't even ask Julie.
We don't need to.
He signed off.
Julie has another meeting to go to.
Cause you know how when we were all appointed, like that had to be our name, like our name had to be on the appointment. It's kind of
Well,
the
they
question
didn't
I'm asking.
appoint the people who were on the group now. But I don't think, I don't know. I mean, or at least you all didn't vote on it, and that's kind of what my confusion is they've had the group where there's been participation, but now there's like a vote, so maybe it's different. Because the money's actually involved now, I don't know.
Probably that's it. Probably that's it.
So just to clarify, so the legal, or rather the code, does the code have specifications, just that it has to be somebody from the health department has to serve on the board? Is that correct?
That's
Do I
what,
understand that
that's what
correctly?
I understood was the request.
But-
And maybe I'm completely wrong, because I heard the recommendation.
That's the request of the commissioners at this
Right.
point. Yeah.
And that, you know, the recommendation was that it be this person because
Mhm.
she's been doing the work.
Okay,
However, the request was that someone from the health department sit on this commission. And so that's why I made the motion the way that I did.
All right, so why don't we do two motions? And we do one that appoints the person, an employee from the health department. And then say,
We recommend.
we recommend
Okay.
that it
So
be,
the motion on the
second motion.
floor is
yes,
already that we appoint someone.
yes,
That we
health department employee.
be appointed to the opioid review committee.
Okay.
Was-
Any second on that, for that?
I'll second it, given that we're having a second motion regarding the specific appointment of Kathy.
All right. All right, it's been moved in second. Further discussion? All those in favor, please say aye. Opposed? Now,
Is there a recommendation from the board?
Then I would recommend that Kathy Hewitt be appointed the Monroe County Health Board employee, appointed to the opioid settlement funding Review
health
commission.
department employee. Health, you said health board,
Health Department, excuse me.
and you second.
He
So it's been
seconded it.
moved and seconded that Kathy Hewitt be the health department employee that we appoint to the board, or at least make that recommendation.
Mhm.
Any further discussion? All those in favor, please say aye. Opposed? Congratulations, Kathy.
Thank you, Pat.
Thank you
I
very much. So,
Yay.
I think it's congratulations. I'm not really
Right,
sure.
right. Yay, more work for Kathy.
I like work. So thank you.
Dr. Robinson, you we added another agenda item, the IU health contract with Public Health Clinic. Would you like to lead the discussion on that?
Yes, so, this contract will come up for, again, at the end of 2024 to revise the contract. So I just wanted to start the conversation now about a couple of items. We have, there's these KPIs that we're responsible for the First Health funds. And we did have a discussion at our meeting 2 days ago with Lindsay and Amy Meeks about getting these weekly and monthly reports instead of just having quarterly reports, so that Lori can prepare her reports for the state and not be waiting just till the end. And then we can also, that's a good way for us to track, what's happening as well at the clinic. So there's that. I just want to make sure we're getting the information we need to do what we need to do.
With the understanding, probably that's going to take a while to be ramped up because their new data analyst has a lot of demands on them right at this point, right? I mean, I think it's great information. It's probably going to take a little bit.
Sure,
Yeah.
sure. Right, well, I guess I'm concerned because I guess I'm wanting the process to be sped up a little bit. And so that we have the information we need to be in compliance with the state and I want it to be a cooperative thing, but what I don't want is just, we get the reports and it's really late and then we have already not met the deadline to turn that information in. So, so the other piece of this, and I may need to understand a little bit better about the payments that go through VaxCare. So the contract currently says that 80% of the funds that get routed through VaxCare get paid to the, to IU Health, and then 20% gets paid to the Monroe County Health Department. And we have the staff, I think, to be administering the vaccines, and even we saw the the refrigerators they purchased, I think, is through funds from the Monroe County Health Department. So I think we have the resources to, we're administering those, and so I think we should get paid that. It should be flipped, I think. Instead of 80-20, we should get paid the 80% and they get paid the 20%. And so I just wanted to bring that up for discussion before, so that we can start to talk about it ahead of time. So we're not in December, when it's time to renegotiate contracts, we're not like, well, okay, we haven't thought about it.
Does anybody know where the 80-20 came from in the first
No, I was
place?
hoping Lori could tell us.
That was prior to my time, and when I came into the position, it was something that I noticed, and was kind of curious about how that kind of was determined or came about, but I don't have any idea, how it was actually, determined. I don't know if if it was a board vote, if it was county, if
Do you
they
guys
just,
have any?
It's not been a board vote while I've been on.
Well,
and maybe it
So
was
it
just
was one of
added.
those many things.
I'm guessing COVID had something to do with it, wouldn't you think? We had to contract with them for COVID and
Could be, that's kind of what was, maybe that was what was established with the COVID funds, so they just added that for all of the vaccine reimbursements, but I mean, surely they've been getting
That's true.
vaccine reimbursements longer than COVID.
I'd love to be able to find it.
Do we know
and-
how
fine.
And
long
full
it's-
of
I
content,
was gonna say, I'd love to
and see
know
what
why
it
it's
used to
going
be.
on.
Because maybe it did get increased
And-
from COVID because maybe they were doing increased work and maybe historically it was 50-50, for example.
yeah, IU was operating clinics actually during the COVID time. And they were using their facilities, so that could have justified a more weighty share for
Well,
them.
thank you for raising that. It's certainly
Yeah.
good to find out more about.
That's a very good point.
I like that proposal. It's,
So do we? Okay, so you're gonna
Lori's gonna look into it.
look into more information about maybe how it was
Yeah.
previously. Okay, great.
I don't think it was ever brought to the board.
Mhm.
Just,
It's an interesting
Whatever.
find. Yeah, so.
I have no recollection of ever discussing this. Yeah.
Time waiting.
Time we did.
Yes. They're always
Good work,
looking for another
Dr.
cost
Ross.
center. Yes,
Good noticing. Okay.
no block.
Is that it for agenda?
Did you have something else?
Oh, I have, as board member comments, I have one other thing. I was gonna ask Dr. Britton, how, or continuing the discussion about, syphilis testing in the jail through the DIS grant, like where,
Crickets. I can't get any response from them.
so I called and talked to the, commander, Matt Demings, the assistant jail commander. And so I said, April Haskett through Hope is currently doing STD testing for pregnant inmates, and that they had taken over the syphilis and gonorrhea and chlamydia testing for males as well. And he said, yeah, that just kind of happened because April Haskett and her group said that they could actually just do that. And so I talked to him and said, hey, we have our DIS grant. We need to meet criteria for this. We would like to, move GC chlamydia syphilis testing back into the jail and coordinate for that. And he said, oh, okay. So I said, okay, well, what kind of has to happen? And he said, well, he would appreciate a call to April Haskett saying, hey, we want to take over this part, not the pregnant inmates part, because Hope is still going to do that, but for those who requested, and they have about, I think he said about 20 people a week who are asking for testing.
Yeah,
So then I also told him that we need to coordinate April Haskett getting the data from their positive test, they need to, or rather from their testing, that needs to be given to the Monroe County Health
Yeah,
Department.
that was my
Because they
question.
skipped us and they've just sent it to Indiana Department of Health directly. They just don't
Well,
tell us the
They don't want
data.
it. The state won't even take it. It has to be routed through a district for STD.
Correct.
So God
So,
knows.
so number one, someone reach out to April Haskett. Number two, April Haskett needs to understand that she needs to route that data through us. And number three, Matt is happy to coordinate with, whomever, Dr. Britton, Lori, to get, DIS staff back into the jail performing testing. So I have April's number
Oh,
or
let me
email,
know,
I have
yeah.
Matt's information, so if I made copies for everyone if you want to do that.
Yeah,
I'm
I sent,
a little concerned. I'm not sure our ask was, we want it back and the DIS have to do it. I mean, I think our position was, as I understood it, somebody needs to be doing STD testing of this population. And as far as we knew, and indeed it was not being done, like it was not being done before Hope Resource Center
Right,
got in
okay,
here, right?
but we have the grant
Is the
money,
county
and we-
paying, is the county paying to have this testing done?
Somebody's paying and
I
it's
mean, are they-
not us, but if we take it back, we're gonna have to pay to process those specimens, we're gonna have to pay to send the DIS.
Yeah.
Why would we
But we
do
have money
that?
to do that.
But
It's
why would we
designated
do
to
that
the
if it's
grant
being done?
money, that's what we
That's
need
what's,
to keep our grant money
No,
for DIS.
no,
It isn't?
no.
Okay, so
But we do want the data.
Yeah, we need the reports. That's law. That's not anything to do with the grant. Do you, is there, as far as you're aware, in the latest grant, do they have a requirement that they themselves are required to test so many people in so many county jails? That was never part of the STD grants. Is that a new thing?
I can't, I could not say with certainty, but I do not believe that's, like explicitly stated.
No,
It's the district providing the
it
services
never
for the
has. It
district.
never, ever was. I don't think it is unless it's brand new. Our, meaning the health department, the DIS, our concern is that it's being done and that we are getting the disease reports and that if there is a case investigation that has to happen, for example, a syphilis case, that we are allowed access to conduct an interview with that patient. Those are the
who's
big asks.
responsible for,
That-
who's responsible for treating?
They would have to be.
The jail.
The jail,
Has to
right.
be, yeah.
yeah, they're the custodians.
They're the custodians, they have to treat.
So what we really need from April Haskett is that she makes sure that all the test results come through Monroe County.
The
That's the
posit-
bigger deal.
Positives are reported
Yeah,
and that someone facilitates DIS access if a case investigation has to happen.
So you have April's contact stuff.
yes, I have this. So DIS, so we don't need, or I thought that we needed DIS to, I guess I don't understand. I thought we needed DIS to facilitate this and so that we could keep the grant.
They're
monies.
providing services, to our population and to the other counties in the district.
So you're saying it doesn't matter who does it, we just need the data, I guess is the,
That seems like, I mean, as a public health entity, that is the key element of that, I think.
Yeah, if not
so we,
DIS, who is going to do the diagnostic?
And our concern when we started this was that Hope Resource Center had not begun doing this yet. And we had learned that nobody had been testing those inmates for a very
Right.
long time. And
Very
when our DIS tried to go in and do that, they were
rejected.
barred.
so we don't, you're saying we don't want them to go there.
Not if somebody's doing it and paying for it. Well, if Hope Resource Center is doing chlamydia, gonorrhea, and syphilis,
testing,
yeah.
and we simply want their results.
So then so Clark, when you communicate with Matt, I guess, and April, maybe together, it's more just that we need the data as opposed to
That's kind of,
to them going into the jail to do that.
So, but there was somebody had some rumblings about, the wedge issue of religion and so forth with,
That was me,
yeah,
because but that's probably all been taken care of, because
that's kind
it
of
looks,
peripheral, isn't it?
it looks like, yeah, it's perfect. I mean, it looks like they're doing enough work in enough places, and that's not an issue, so it's not an issue.
So, so the big issues are, we need the positive test results to come to Monroe County when the testing is being done in Monroe County Jail, and the Monroe County Health Department.
Well, and Lawrence, we cover Lawrence.
We cover
too, and
Lawrence,
They're
okay.
testing in Lawrence.
Okay. That we need the Lawrence and the Monroe County positive test results. And we need for our investigators to have access to the inmates who test positive.
Bingo.
So wouldn't we have more assurance that we are dealing, as a county health department, we are dealing with the neonatal syphilis issue specifically by not having a third entity to rely on? I guess that's my question. Wouldn't it be better to have our people there doing the testing, gathering the data, and they're awesome, the folks who administer the grant and go out into the community, and I mean, wouldn't that be a better plan? I guess
I
that's
mean,
my question.
it's a good question. I would say it depends on how reliable your partner is. Because we, all over the country, have, for example, physicians in private practice who don't want to work with public health and will not report cases of disease and will not allow DIS to interview their patients. And there's no reason to believe that the people from Hope Resource Center won't work well with us. All we need is someone to work well with us. That's,
And if
so it
that
doesn't
doesn't
have to
happen?
be us. If that doesn't happen, that's a whole other thing, because the DIS are required by state law to conduct interviews on people with syphilis and HIV. And the county, each county health department is required to decide if it's going to conduct interviews on chlamydia and gonorrhea. So the DIS have to, the DIS have to be able to do that. But in most cases, the person doing the testing, whether it's a clinician or hospital, family clinic, they let that person in. I mean, we go over to IU Health all the time, for example, and interview their patients, and they report their case. This would be the same type of method, but we don't pay for everybody's testing because we couldn't possibly. So in this case, if somebody's paying for it, I don't know how Hope Resource Center is getting their testing paid for.
I'm sure it's.
I have no idea.
So,
But if they're paying for it, that's awesome. One less thing we have to pay for.
So basically, what we're wanting is the data.
and to
And
have
access to positives if we need.
Yeah, yes, right.
And,
To interview the more critical cases.
Yeah.
and I would certainly want to know from April Haskett, do all pregnant women get tested?
It's my understanding it's voluntary. They have to come request it, I believe. But she could give details about
I
that.
mean, that would be the other question, is especially the pregnant patients, we would love to know.
I'd be happy in a world where all the pregnant people were tested for syphilis.
But, I mean, if they're going into the jail and doing this work,
But
then
there was an enormous
that would be my,
lawsuit in Cook County when I worked in Chicago on exactly this issue. Because the health department was there and we were taking at that time all incoming inmates. And we were testing them for chlamydia and gonorrhea. And guess what? Somebody filed a lawsuit and we had to stop because you can't, they have to
Thank you.
consent.
and you can keep it.
Okay,
And
thanks.
the
I
question,
would be very curious to find out how these people are being paid. They're not doing this just
out of the goodness of their heart?
That's my
Because they're
question.
doing it in multiple places and it must be
It's gotta be a grant, I'm sure.
lucrative in some way.
Mike, I think your concern was that it's ecumenically funded.
No, not funded. I was concerned it was one of the, pregnancy resource centers that
Oh,
was
yeah.
And
crisis
using-
pregnancy.
Yeah, they were
yeah.
gonna use it
Yeah,
as,
that's what
that
you
was
said.
using this as a lure to draw in.
as a way to get
Yeah,
in.
yeah. But clearly, they're not doing that if they're doing all this work in jails. But we should also point out, if people are making notes, the DIS cover a 7-county area. So if the Hope Resource Center is doing testing in any jail system in our catchment area that's not Monroe or Lawrence, then we need the same thing from
The other places.
every one of those jails. And I don't know how far Hope Resource Center reaches.
No, well, I guess we can ask. And see what other jails in our catchment area they're covering.
So what communities would have the jails in? Lawrence
Well,
County?
Vigo County, Terre Haute, Vigo
Yeah.
County. Who else would have a county jail?
Lawrence.
Brown Bartholomew. We cover Brown Bartholomew. Vigo, help me, Green,
Putnam.
no,
Oh,
Putnam's
are
in,
we over?
Putnam's in
We far
District
as
5.
Probably Owen.
I'd have to look on a map. Owen for sure. So I don't know if they all have
Plus
jails.
Monroe.
I don't know if they all have jails. I think we do Green. Yeah.
But thanks for making those calls.
Anything else? Under board comments, you're gonna be interested in this. I've had 2 conversations with the mayor's office concerning my frustration, which I vented on the first person, in that we had nothing from their office, no action. And the person I initially talked to several months ago is no longer in the office, so I think it just kind of got dropped. So someone called me back who was, and sorry, I forget her name, but she was very responsive, and I gave her Dr. Milliken's name, and I suggested that she go ahead and submit that name. One of the caveats was that they're supposed to submit 3 names, of which the commissioners then, well, that's not all that easy in Monroe County. So I suggested that she simply submit the 1 name, and well, anyway. The problem is that Dr. Milliken has taken a Democratic primary ballot sometime in the last couple of years, and he was rejected
Okay.
because of that.
Okay.
He may be of the correct political affiliation that we need at this current moment, but
Yeah.
there's some history. I think George may know of something about that.
Two
seasons.
2 in a row.
Consecutive, yeah. Okay,
2 consecutive.
got it.
So
So,
we're back to
yeah.
square one here,
Oh,
with that, so. Very frustrating. But I will say the person called me twice in 3 days,
Okay,
and so she submitted the name immediately. And was on it, so, and she said, now that I have talked to you and I know you are, that I will never help you again. No, she said, she said, she would be, yeah, it would be on the front burner to find somebody, but we'll see. Anyway, if you have anybody else, let me
Okay,
know.
I'll work on it.
Also, my final comment was, I was very disappointed to see that, and we've mentioned that it was that the MRC basically is non-functional as far as anything to do with the health board because of liability issues. And I think,
I also am very displeased.
and so I think there's something happening, what, maybe it was in some of the, or maybe you said something about it.
I'm meeting with Avery
Yeah, you're meeting
tomorrow.
with Avery, that's it.
But Avery's not gonna know anything about
Right,
this. We
yeah.
need an attorney
Yeah, I
to tell
know.
us what the problem is and how we resolve it, because this was never a problem in the past.
Well, it begins and ends with the state health department, I think. I mean, that's
How
part of it.
so? How is that? Can you?
Well, I mean, they have a medical reserve for, it, right? The state health department,
Well, you,
whatever their protocols are,
yeah,
would be what we would mimic.
so,
Gonna try to find out what that is.
well, okay. I thought maybe you had the answer.
I don't have the answer. I'm looking for the answer. Okay.
Yeah, I'm not convinced it has anything to do with
I
the
don't think.
state.
I don't know.
It's a county.
State.
I think it's similar to what we went through with your,
That's exactly
Library.
right.
Well, yeah, that was a go road,
Yeah, so, yeah.
at least.
The second person I uses that phrase, my wife uses it.
Well, there's other
Goat
words
rodeo.
for it.
That's the
I play
polite,
company.
that's the polite.
Yeah.
Okay, and that's all.
Yeah, do you want
Yeah.
Kathy to speak on the MRC
oh, does she, yeah, sure.
about the liability?
Oh, sure. Kathy, or is whoever has their hand up, I think it's Kathy.
Yes, it was me. I have spoken with Jeff Cockrell, our county attorney, and he has contacted the county insurance agency. So, and explained like our concerns and what we need. So we haven't heard back yet. I know we sent the email on Monday, so we're waiting to hear back what they say. In the past, they have done some type of rostering, but we were never sure what that actually covered. So that's one of the questions I've asked, like, will we have liability insurance for the volunteers as well as workman comps in case they get hurt? So I can share that information back with you as soon as I get it.
Thank you.
Okay,
That's what we
great.
needed.
Thanks for
Yeah.
your input.
I would think that it would seem that, if healthcare workers are not being compensated for serving, then it would fit under the Good Samaritan Act. It would simply be the liability issue should any healthcare worker become injured doing it, in which case there'd probably be their own insurance that would cover that.
These
But-
folks are mostly not healthcare workers with any type of licensure. They're mostly people who volunteer and they're not even in many situations providing healthcare services.
Right.
They're
They're
like,
just-
they're marking down, what's your name? Okay, you're next on the list, go in the room. I mean, it's crazy.
It's elemental. Yeah, I know. It's,
So I would assume other counties, again, have to have the same issue. So how are other counties addressing the issue?
And that might be a question for
They're
Avery.
that's on my list.
How does she know how many other MRCs there are in Indiana?
Yeah.
It's not you don't have to have one.
Yeah,
I mean,
but I assume that there are a bunch of them. And,
I don't
and
know.
across the country for that matter.
Across the country, there are a ton. I just don't know how many there are in Indiana. And
Right.
And
if she can talk to any of those to find out, have they had this issue? Have they solved it? That would be
Okay, I can
helpful.
speak to that briefly. This is a national issue. The MRC is
Okay.
organized federal, but they're very clear that it's a local organization. So
Right.
nationally, this is an issue everywhere. So
Okay, thanks. Well,
and
way to bring things to a grinding halt, huh?
Yeah, there you go.
the other thing is that all these things that we've left on the table, I would really love to have a sell-by date on so that we know by what date we will hear back from people about the issues that we have left in hands.
Well,
So that it isn't,
yeah,
like forever.
yeah.
Someday we'll hear about this again.
So I think Kathy's going to
Right.
follow that. And I think what we can do on our agenda for our next meeting, I think we can put on Lisa's issue. So we'll expect a report from Lori on whatever she found about how that 80-20 got like, and we can put on liability, has what's going on with the liability for MRC.
And the jail issue.
and what's going on with the jail. So I think if we get them on our agenda, then we can keep track of them, right?
But it would be nice to know, if we set the agenda up in the mid-month, in between, or even 3 weeks out, I would love to know that that whoever has taken this on as the responsibility has answers that they're prepared to give us at the next meeting. And
That's
I
not a
think-
bad idea, because that's how I always ran the staff meetings at my office.
we have to have a sell-by date. We need to know that you've got the answers, that you've done the work before, the day before, so that it's like sitting up in the air and maybe you'll get a call back. It just seems like action items need to have a particular date by which they need to be acted upon. And maybe that's just my craziness, but I really think that accountability on our part means we actually have those kinds of answers so that it doesn't become a forever issue.
Like getting another board member.
But that's all I can do is
Yeah,
check.
That's all you can do. You
I
can't.
have no authority in this area,
I know.
although they did know, the first person did know that I was not happy. I'm just gonna leave it at that.
Was
Well,
that Crystal?
thanks for
that
the
you
recommendation at least.
spoke? I think it was Crystal you spoke to the first.
Yeah.
It's a good effort.
Yeah.
The first time, but that was
Or
some
was
time
it
ago.
the second one? No, it was Crystal Ritter. I remember just coming
Yeah,
and saying.
Right, yes, but then
That she
she,
was very nice.
but then she's gone.
Yeah.
Yeah.
She's
and-
got another
And
position.
then so the first person I talked to yesterday was probably an intern or something, and then another person called me back, who I wish I knew her, I could remember her name. I can't. Pardon?
Gretchen now.
Yeah, I think it was Gretchen, thank you.
Yeah, you.
It's 6:15.
Yeah, she was very responsive, though.
So
I have 15
remember
minutes
to
more in my
empty
meter.
your
Yes.
folders and put your name tags
In,
and sign.
in my meter. No,
Okay.
no, no.
One final little item from the Lake Monroe, Friends of Lake Monroe. They're still giving the cost sharing for septic system pumping. And our own Shania Cox gave a very nice presentation there. And apparently there's 74 people who've already signed up for the cost sharing of the pumping, and they have up to 200
Wow,
possibilities available.
Well, and I'll announce that I had my radon testing done through Monroe County. And I've already had my mitigation done, and I'm very happy to say that I'm now safe.
have you
Oh, that's
done
wonderful.
post-testing? You have?
I did my own and I've sent off the post-testing on Monday. So, but I watched my levels drop from 45 max to less than 1. So.
Well,
I'm
that's
very
pretty cool.
Wow,
That's pretty high reading.
Yeah, that's
45?
In my.
Four's
in my
the
basement.
limit.
Mine
That
was
was the
4.
highest. Oh.
Mine was right at the action.
Well, my upstairs was 7, so in my living space, it was 7. In my basement, it was between 35 and
My
45.
basement was 4, so we mitigated anyway, just.
Well, I mitigated and it just dropped right by a bomb.
All right, do I hear a
I
motion
move
for
to-
adjournment?
I second.
Yes, all those in favor?
Aye.
All right.
Great. Would remind everyone that we
Well, we
have
will
a
be back in about 4 weeks.
fairly brief, I
We
think,
have a brief
executive session.
executive session, so please don't leave.
And we will all be back here
What's the date for?
as a happy group in 4
It's
weeks.
Thursday,
Yes.
third Thursday, so.
Third Thursday is our witching hour, right?
It's August 15th.
Wow, mid-month,
August 15th it
the
is.
Ides of August.
That's when everybody's witching out there.
Okay, so we need to check. We're officially, thank you.
Possibly useful.